this. Okay. So this is the inside meniscus or medial meniscus, okay, and this is the outside meniscus. So Chester's meniscal tear in the inside meniscus, Gemma, is in the body and posterior horns. So it's about like that, okay. And as far as his lateral meniscal tear is concerned, unfortunately, it's a big tear. It goes from the anterior into the body and into the posterior. So it's like a bucket handle tear. That's his tear in these two areas. There's also changes of cartilage damage on this part of the knee cap, right there, moderate damage. And there is mild damage here and here, these two spots. And the damage that is here is also reflected a little bit in this area. So that's as far as knee is concerned. As far as the hip is concerned, he has a labral tear exactly where this is. So somewhere between 11 o'clock to 2 o'clock is his labral tear. And luckily, the damage in the femoral head or the socket is mild at this stage. It's not moderate or advanced changes of arthritis. So his ball and socket otherwise are doing well. Okay?
Good. Perfect.
So tear in the meniscus. This is still the tear, tear, tear. And now you're going to the other side. The ligaments are good. PCL is good. ACL is good.
ACL.
I mean, it's whatever remaining of the ACL.
I don't have one.
There's a scar tissue. See that scar tissue?
Oh, okay.
Yeah. And this is the tear of the anterior meniscus horn that we talked about. And this is the cartilage damage at the lower end of the patella. And some cartilage damage you can see here, which we showed on that model. So, and some osteophytes here, not terrible.
Yeah.
So that's as far as the knee is concerned. Let me see if I can go into the hair. Okay, Chester.
Unknown caller.
Hello. Hey, good, Jason. What's up?
Going and send your name, okay? Thank you. Marlon, I know which one it is. Thank you, dear.
I might be able to do it today. Tomorrow I have surgeries already lined up, so I'm not going to come tomorrow. So I might be able to come today before 5.
And I'm here to see Dr. Bao. He's not here?
You know, Brad was going to find. Brad had similarly did not have answers for a few
Yeah,
questions.
he's-
He was going to
okay, let me
find
call
out and tell me, because that decides if I have to bring checks or not. So, do you want to just find out from him and let me know if what the contributions can be? You got it. Thanks. Okay, bye. Bye. Hey, Marilyn. Do we have to summon the MRI for the hip as well, or should we be able to pull it up?
Let's
I mean, we can see it. See that? It's there. So why are we not able to pull it up?
Should be.
Yeah, we logged into Paradise server.
So hold on.
That's the server.
And that's all it's showing, huh?
Yeah. It doesn't show the icon for the MRI.
Are they still trying to load it? Maybe let me call Marilyn.
I think you have to retrieve it constantly from the Paradise website.
Oh,
That's
wow.
okay. I got it now.
Okay.
To retrieve.
Hello there. Marilyn. Got it, hon. He figured it out. He got it.
So see the tear?
Yeah, I guess we have to retrieve
the
it
label?
from the website. Okay. Thank
But
you,
but if you look
dear.
at the ball itself and the socket, it's not terrible.
Right.
So there is an anterior labral tear, but joint space is still looking pretty good. There's slight thinning here, but other than that, most of the joint is still very nice. So like that's why I said hip has a much better prognosis in your case. There is thinning of cartilage there, but rest of the cartilage everywhere is not too bad.
Okay, so what is required of Gemma to take care of me?
Gemma needs to, you and Gemma both need to be on top of the fact that if your hip starts hurting you, you gotta see me within 6 weeks. You don't want to wait 6 months once the hip is hurting.
When you say 6 weeks, I mean
So like
hurting-
once it's hurting, meaning your pain is
Unbearable.
you're taking Motrin 3 times a day to just go through the day.
Elizabeth?
If you're reaching that point,
Okay,
then you know you're hurting quite a bit.
okay, yeah. That's,
Okay, so if you reach there, or if Gemma thinks you're limping and she can witness that.
well,
whereas-
no, I do limp because I'm favoring it, but it's not necessarily. I just want preventive pain.
Understood.
You know, but it doesn't hurt.
Yeah, but the minute the day it starts hurting,
Right.
I think you gotta try to get through to me sooner than later.